Good day, sir. So my name is Kathleen Perez, and with Miss Karen de Guzman, we present and discuss our topic, which is the gastroesophageal reflux disease. So let's proceed to the introduction of our topic. First is the pathophysiology of the disease, signs and symptoms, possible complications and consequences, and treatment guidelines of the disease. The pathophysiology of GERD is multifactorial and is best explained by various mechanisms involved, including influence of tone of the lower esophageal sphincter, the presence of hiatal hernia, esophageal mucosal defense against the refluxate, and esophageal motility. Gastroesophageal reflux occurs when less pressure is lower than the intragastric pressure, such as in less hypotension, increased frequency of transient lower esophageal sphincter. So, hiatal hernia result from multiple mechanisms. It is associated with a decreased less pressure, decreased acid clearance, increased reflux, and more severe esophagitis. While mucosal defense mechanisms may be overcome by prolonged exposure of the esophageal mucosa to pH4 that may lead to severe and complicated esophagitis. So, in the image, we notice the difference of normal and with gastroesophageal reflux disease. So the lower esophageal sphincter of a normal is closed while with GERD is open. And the backflow of acid in the stomach contents into the esophagus causes heartburn. So the potential complications of GERD is first in the picture is erosive esophagitis. This is condition is severe from gastroesophageal reflux disease of acid reflux in which lining of the esophagus by the backup of reflux or stomach acid. Once the esophagus is eroded, it can take 6 to 9 months of treatment for it to fully heal. Some of signs and symptoms of this condition is chest pain, chronic cough, blood in vomit, difficulty or pain when swallowing, heartburn, and burning feeling in the throat. The second one is esophageal stricture. It is a condition, the abnormal narrowing of the esophagus, and it is a tube that passes food down from your throat to stomach and make it hard for you to swallow the food, that you will feel like something is frozen or stuck in your throat. This condition is also make it hard for you to drink liquid easily, and it happens rarely and affect people of all ages, especially those older than 40. The third one is Barrett esophagus. This is a condition which the flat pink lining of the swallowing tube that connects the mouth to stomach becomes changed by acid reflux, which causes the lining to thicken and become red. It is also can result from long-term exposure to stomach acid, and the certain medication of this condition are sometimes enough to stop symptoms of Barrett esophagus that result from acid reflux. The medication of this condition are antacids to help neutralize the stomach acid, H2 blockers to stimulate certain cells in the stomach and to produce acid, also proton pump inhibitors to reduce stomach acid. So the actual patient case is CR, a 44-year-old man, comes to the pharmacy looking for a remedy for his heartburn. He reports that his heartburn has been bothering him for the past few weeks, and he complains of an acidic taste in his mouth and a burning feeling in his throat about twice a week. CR does not complain of any related symptoms such pain when swallowing, and he has a box of omeprazole in his hand. He asks if it would be the best product to help alleviate his symptoms. The objective information of the patient is he had an acidic taste in his mouth, burning feeling in his throat, and his heartburn has been bothering him for the past few weeks. The patient assessment is there is no issue with the patient pharmacological treatment because no other significant symptoms that the patient was displaying that could be mistaken for conditions other gastroesophageal reflux disease were found, except for acid reflux and dysgeusia. It is frequently used for self-medication of digestive disorders. The patient is thinking about using omeprazole as treatment for his illness.
In the continuation of Miss Perez's discussion, so let's now discuss about depression impression. So the signs and symptoms listed may indicate that the patient's lifestyle lead to severe acid reflux. If GERD is not effectively handled, as well as a lifestyle modification, the patient's health may get worse. Thus, the patient should keep a close eye on their diet, avoiding things that can cause acid reflux, such as spicy foods and carbonated beverages. Furthermore, smoking can increase stomach acid production and impair the function of the lower esophageal sphincter, the muscle that prevents acid and other stomach stuff from re-entering the esophagus. Smoking can also reduce the amount of saliva generated by the body, which can lead to heartburn. And also, the patient should maintain an appropriate weight for their height to avoid the pressure caused by the fats in their stomach. So here are the symptoms of acid reflux or having a gastroesophageal reflux disease. So here are the 8 common symptoms. So first, bitter taste or vomiting. Second, belching or having a bad breath. Third, sore throat that can lead to pain or swelling in throat. Fourth, stomach noises or gurgling of bowel. Fifth, dry mouth or lack of saliva. Six, tooth erosion or dissolves enamel. Seven, heartburn or burning in pain in chest. And lastly, bloating or burping gas. So here are the medications of having a GERD, or here is the medication of the patient mentioned a while ago having a GERD. So its medication or its first option, and it is the best option of medication having a GERD, is omeprazole. Its dosage form is oral delay release capsule. For its dosing and frequency for adult, 20 milligram um, once daily. For severe cases, 40 milligrams once daily. And for maintenance, 10 milligrams daily, or it may increase to 20 to 40 once daily if necessary. So the duration of this therapy, um, it uh, it between 4 to 8 weeks. So here are the expected outcome. When will this outcome if you finish the medication? So omeprazole is a substituted benzimidazole gastric anti-secretory agent and is also known as protopump inhibitor. It can block the final step in gastric acid secretion by specific inhibition of adenosine triphosphate enzyme system present on the secretory surface of gastric parietal cell. Both basal and stimulated acid are inhibited. So here are the possible side effect and adverse effect: nausea, vomiting, diarrhea, constipation, flatulence, and abdominal pain. So here are the signs that the treatment is not working or the omeprazole is not working. So you can continue to get symptoms of heartburn. Your symptoms worsen when resting or sleeping. Your symptoms occur after eating. You're still experiencing a bitter taste and frequent regurgitation. You're noticing hoarseness and extra saliva. And lastly, you're a bloated or burping nightmare. So here are the counseling points when omeprazole is being used. So contraindication, concomitant use with nelfinavir. Special precaution, patient with reduced body store or risk factors for reduced vitamin B12 absorption, risk of osteoporosis, hepatic impairment. So children, elderly, and pregnant and lactation, CYP2C19 ultra rapid metabolizer. So here are the drug interaction for omeprazole. May decrease plasma concentration of nelfinavir and atazanavir, increased risk of hypomagnesemia with diuretics, may increase plasma concentration of tacrolimus, methotrexate, may decrease absorption of itraconazole, ketoconazole, posaconazole, and erlotinib, may decrease metabolism of diazepam, phenytoin, silastazole, and also may decrease the antiplatelet activity of clopidogrel, may increase bioavailability of digoxin. So here are the possible solution, or here are the management for having a GERD. So according to our guideline, there are 8 treatment guidelines. So first, lifestyle modification. Lifestyle modification may benefit many patients with GERD, although these changes alone are unlikely to control symptoms in the majority of patients. Second, patient-directed therapy. Antacid and OTC antacid suppressant are options for patient-directed therapy for heartburn and regurgitation. When symptoms persist, continuous therapy is required or alarm symptoms or signs develop, the patient should have additional evaluation and treatment. Third guideline is acid suppression. Acid suppression is the mainstay of therapy for GERD. Protopump inhibitor provide the most rapid symptomatic relief and heal esophagitis in the highest percentage of patients, although less effective than PPIs as histamine 2 receptor blocker given in divided doses may be effective in some patients with less severe GERD. So fourth, promotility therapy. Promotility agent may be used in selective patients, especially as an adjunct to acid suppression. Fifth, maintenance therapy. GERD is a chronic condition. Continuous therapy to control symptoms and prevent complication is appropriate. 6. Surgery. Anti-reflux surgery performed by an experienced surgeon is a maintenance option for patients with well-documented GERD or if the GERD is not managed by a medication. So 7. Endoscopic therapy for GERD. So endoscopic therapy controls symptoms in selected patients with well-documented GERD. And lastly, refractory GERD. GERD is refractory to medical therapy is rare. The diagnosis should be carefully confirmed, preferably with ambulatory pitch testing prior to anti-reflux surgery. So here are the recommendations for the patient having GERD. So we recommend for the patient to avoid food such as fat food, cheese, citrus fruits, and carbonated beverages that can trigger GERD and delay the digestive progress, letting the food sit in the stomach longer. Second, we recommend for the patient to watch its diet by eating foods that can prevent GERD attack like high fiber foods, brown rice, alkaline foods like bananas, and watery foods like watermelons. Third, monitor the patient esophageal pH to prevent from becoming gastroesophageal reflux disease. And lastly, monitor the patient blood pressure and oxygen saturation as there is a significant correlation with the GERD. That's all. Thank you.